turn our attention to a local Tyler physician who joins us now live to offer some advice after IDing 3 coronavirus cases in his patients. So thank you right now for joining us, Dr. Stephen Spain. We appreciate your time, sir.
Thank you.
Just in front of the testing clinic that he built himself, right, sir?
I'm sorry, I didn't hear that.
You're right in front of the testing clinic that you built yourself, right?
Yes, this is a test facility that we erected out behind my office.
Now, out of the 15 people you tested first, 3 came back positive. Were you very surprised about that?
That was frightening to me. I was surprised. We've since tested probably twice that many, and we've not had another positive yet, so I'm encouraged by that.
Should we have been more prepared for a situation like this?
Was I prepared for a situation?
Should we have been more, as
so.
a country, should we have been more prepared for a situation like the coronavirus?
Particularly from a testing standpoint, I wish we had been more prepared. I think that with the help of the federal government, they're certainly rolling out resources pretty quickly and pretty efficiently. I mean, this caught all of us off guard. I had a little bit of inkling that it was coming and was fortunate enough to have a setup with a lab that could do some testing for us. But by and large, I think the ability to test for the virus has been one of the biggest problems in being able to stop its spread.
So once we get done with the situation, how can we be better prepared for the future?
Well, I think just a better job of, I think now we understand what a virus situation like this could do to our country. So I think people are going to take it much more seriously the next time around and respond more readily. And I think we'll have a lot more resources at our disposal the next time that this happens, because there probably will be another time.
Now, there is still a whole lot of misinformation about COVID-19. This is far from just being the flu, right?
I think there is a lot of disinformation, but I think the important thing for people to understand is that if you are sick, particularly if you think you have been exposed, you should probably seek testing or contact your health care provider about whether or not you should be tested. And if you think you're sick and you've been exposed and might have the virus, you definitely need to act as though you have it and you could be infecting others. So quarantine yourself for 14 days or at least until you've tested negative.
Now, I know the medical community wants to take its time with this situation, but what about business people out there who are about to lose everything they have because of the shutdown? Can things be speeded up at all, do you think?
You know, that's a huge dilemma, and my expertise is in medicine and not in business, so I'll have to leave decisions like that up to the businessmen and up to the government about what best to do for the economy.
We have about 30 seconds left. Anything that you'd like to tell our audience that I have not asked you about so far?
Well, I think the main thing is continue to social distance. If you are sick, you should ask your provider about testing, especially if you think you've been exposed to coronavirus. And people who are sick should stay indoors and not be around other folks.
Doctor, thank you very much for your very valuable time, and good luck with the fight, okay?